So hey everyone, this is Gabriel. I just wanted to make a video about how I treat my scars after top surgery. So here I am just after a shower and I need to oil the scars up, so I'm going to show you guys what the chest looks like. So I am about just a little over 6 months post-surgery. The scars are healing up pretty good. There's some good mobility in it, so that's really what you want. When I first had the surgery, there were really thick ropes of tissue that were around here. It was really solid and hard to move around. And you want to break that up so that you're not having a lot of problems with the tightening of the tissue and everything. So that's where I am so far. Some of the scars are starting to fade. The ones under my armpits are a little bit bigger. And that's probably due to just stretching from side to side while I was still healing. So the stuff that I used, of course, you want to make sure you're all healed up first, so you don't want to start this right away. Make sure that all the scars, the incisions have healed up. And I actually started out with castor oil. This is stuff from Acacia, which I just found at Whole Foods. And the castor oil doesn't actually have any vitamin E in it. Interesting science about the vitamin E. In some cases, it's more of a problem for healing than in others. So I wanted to avoid vitamin E while I was still healing up for the most part. But then I moved to this stuff called rosehip seed oil. And at first I was using the same Acacia, the same brand as the castor oil, but I ran out of that. And this is the brand that I'm using, which is called A Cure. It was also found at Whole Foods. They're basically the same thing. I actually just really like the Acacia pump better, because this one, it's like you either pump it and get tons of stuff or you get nothing. So it's hard to control the amount for that. Anyway, I started with the castor oil, and then I moved into the rosehip oil about 2 to 2.5 months after I had completed the healing up of the surgery. So the rosehip seed oil, I haven't been able to find any that doesn't have vitamin E added to it, which is why I delayed using it. But the vitamin E is in this one, so if you're looking for stuff that doesn't have vitamin E, possibly start with the castor oil first. And contrary to popular belief, the castor oil doesn't really have a scent to it. So you're not going to walk around smelling like anything weird. The rosehip seed oil does have a little bit of a scent to it, but it just smells like oil. So it's not really anything all that bad. Anyway, so I'm going to show you what I do. So I just get out a little bit of a pump. Again, I don't like this one, and then I'm just going to spread it over the scar until it's kind of evenly covered. And then on the other side. And then I get a little bit more, and then I'm actually going to go ahead and put that on the nipples. I got grafts, so you want to make sure you keep those moist. I know that sounds really weird. Sorry guys, I'm fondling my nipples, but it's to make sure that they heal up really nice. So keep in mind that when you get grafts, you've cut off the sweat and oil glands from the skin, so they get really dry really fast and can crack, and it's not really pleasant. Luckily you can't feel much from it, but hey, it's better to have nicer nipples than not. So anyway, I'm gonna come up here again so you can see what I'm doing. So I'm just gonna spread the oil back and forth across the scars at first to kind of warm the tissue up. And just so you guys know, I actually, well, I used to be a licensed massage therapist. I stopped doing massage back when I lived in Tucson, but I was nationally certified, went through a lot of classes and stuff like that. So these are the techniques that a massage therapist will also use for that. So you always want to warm the tissue up first before you go into any type of deeper tissue work. So I'm just going to go back and forth. There's plenty of oil on my skin, so I don't have to worry about getting more. But if you didn't pump enough and this starts to hurt, or if it doesn't feel great on your skin, you can always get a little bit more. I'm going to raise my arm up, and then I'm going to start with little circles. I actually start on my left side for the most part. It doesn't really matter, but my left side was the one that I have to work the most. It didn't really heal that great. At first, I had a lot of problems with pain and swelling and stuff on this side. The right side healed a lot faster, but now they're basically the same, so it's not as bad. But I still get some pain, especially in this part here. Well, I would call it tenderness, not really pain, up in the armpit area on the left. So I kind of work the left a little bit harder than the right. I'm going to do these kind of round, circle-y motions in order to help loosen the tissue up a little bit. And go back and forth. And we're going to go on the other side. So it's really important. I know some people talk about lymphatic drainage, and that's a good goal to have, especially if you do have a lot of swelling. In that case, if you are having a lot of swelling, it's better to actually, and lymphatic drainage massage is a specialty that I didn't get into a whole lot, but you actually want to do lighter strokes at first. So if you're doing lymphatic, you'd want to stroke really gently towards the heart, or the center of the body. So you don't want to do lymphatic drainage away, you're going towards, and it's basically just light brushing. If you go any harder, you're going to crush the lymphatic veins, which that happens, and that's okay. They pop back, but it may take a little while. So when you start, you actually want to have really light, almost kind of feather light strokes, and you're just going to bring it back like this. So if you have a lot of swelling, start from the armpit and move inwards. I don't have as much swelling anymore, so I'm not as concerned about it. But I do tend to go back and forth up and down the scar just to kind of get both directions going. So I'm here. I also tend to work the armpit a little bit more. Again, the scar is thicker on that side. You can see though that even working it, it tends to fade it out a little bit, which is nice. But I'm going to work the armpits a little bit more just because that's where I seem to have more of the problems with adhesions and with a thicker scar tissue and stuff. Okay, so I seem to be pretty warmed up for the most part, just kind of evening out the oil here. So then what I'm going to do once I'm warmed up, I'm going to go up and down, and this I'm actually using a lot of pressure. So this isn't entirely pleasant. It's not painful, and if you do have pain, you probably should not do this, but this is the motion that's actually going to break up those adhesions. So when I had that thick ropey tissue, and I still actually have a little bit right here where there's some adhesions that are kind of hard to get to. So I'm pressing up and down, and I'm actually pressing about as hard as I can to break that tissue up. I go a little bit lighter in the armpit because it's not as pleasant, but I am still working to get a lot of that tissue moving around in there, so I'm still pressing decently hard. And same thing on the other side, so pressing in really, really hard and going up and down. So remember, this is why you want to make sure that you're completely healed, that the doctor has cleared you for going ahead and using stuff on your scars, all that, so that you're not causing any problems with scarring. It's better not to stretch or anything like that, to have nice thin scars. So don't start this too early. Make sure that your doctor is okay with you putting anything on the scars. So again, really kind of getting in there. My right side doesn't have a lot of tissue that's like the adhesions, so I'm not working it super, super hard. I do have some more in the middle here, so I'm just kind of gently working that. And then I'm going to work more in the armpit a little bit, kind of rotating the tissue around. Make sure the tissue is nice and warm. You should still have plenty of oil on your fingers. That shouldn't be an issue, but you can always get more. And then I'm going to go for another round. Still trying to break up all that adhesion tissue. Again, this is where I have the worst of it. It's not painful or anything. It's just kind of there. I'm going to work up into the armpit. And then I also like to work this scar, this part of the scar. Again, it's a lot thicker, but you can see already how pale it is from working it. So that's a good result. So I'm just going back and forth, loosening all of that up. And hey, if you like the music, shameless plug for my friend Stephen Archer, this is Stoneburner. I love this music, it's amazing. And that other side, again, working the places where I have the worst problems here. All right. So if you have any other places that are kind of sticky, that you can feel that are really ropey, it's a good idea to work through those again. I'm gonna get off some of the oil from my hands, just on a tissue, and then go back through and see if there's any other places I can work that feel like they need a little bit of stickiness, or that feel like they're sticking a little bit. And I don't do much with the nipples past just putting the lotion on, or the oil on. So by getting a lot more of the oil off of my skin, or off of my hands anyway, then when I go back in, I'm don't have as much oil on the scars, and I can work that through a little bit more. So just go back and forth. If you have really tough tissue and you're having a hard time with it, and be relatively gentle and patient. You have a lot of time to work on this, where it's not going to cause you a lot of problems and be permanent. But you actually can use your knuckles, which is going to be a little bit more painful. But in order to do that, I would use this part of the knuckle rather than this, or the fist part. So in here, basically what I would do is just go back and forth like this. This seems pretty extreme, so I wouldn't do this unless you actually had a lot of adhesions that you're having trouble with. With the fingers, it's a lot more gentle, and it's still going to be pretty effective. Okay, so then once I'm done with that, I'll pat off a little bit of the extra oil. Obviously I'm on testosterone, so I'm having a little bit of breakout problems here and there, but it's not super bad. This oil shouldn't do too much. It's actually good for the skin, and you can see I get it actually where there isn't a whole lot of oil for the most part. But I'm just going to pat off any extra, but I want to leave the majority of it on to soak into the scars. And then I also use this stuff that's called Luxamend. So in the mornings, so I shower in the evenings just because it's how my schedule works out. But I use this stuff called Luxamend for the mornings. And so this is the stuff that my doctor, actually my dermatologist, prescribed for me. So this is prescription. It is a wound cream, and you actually can use this on your grafts as well. I really haven't. I'm still using the tube of the bacitracin that my doctor had given me when I was healing. But the Luxamend is safe to go on the grafts once they've healed, so you don't want to put it on until they've healed up. But basically it's just a cream. I don't put it on over the oil, so I only put it on in the mornings. But it's a cream like this, and I just basically spread it all over the scars in a pretty thick layer. It's a thick cream, and that seems to also be doing pretty well, but I don't massage it in, so I just put it on and then let it soak in. So ask your doctor. I'm not a paid advertiser anyway, but the Luxamend seems to be working pretty well for me. I know there's a lot of other stuff that people have used, silicone cream and stuff like that. I haven't really been able to find it cheap enough for me to get. The oil is pretty cheap, and the Luxamend is covered by my insurance, so I actually don't pay anything for it. So that's just what I've been using. Anyway, let me know if you have any questions about that. I can give you advice about massaging. Again, I'm not licensed anymore, but I did used to be a massage therapist. So if you have any questions about how to do anything.